pretty high that you're familiar with CFPB's Consumer Financial Health Study released last. Our national survey reveals that 57% of Americans are struggling financially. As we think about journeys, including Clearpoint, CFPB had a journey also and an evolution on how we really thought about this issue of consumer finances. And it's important to note that this number, using the determinants of health, is larger and more inclusive than our previous metrics of underserved or underbanked. Using those definitions, we were talking about 68 million Americans as opposed to 138 million Americans that are struggling financially. CFPB has worked hard to determine the appropriate ways of measuring financial health and has created a set of metrics to help us do so. Within 4 large buckets, spend, save, borrow, and plan, some of the metrics we use include spending less than your income, paying bills on time, having sufficient short-term, long-term savings, appropriate insurance, planning ahead. You'll notice among the metrics that we've created, there's only one specific product call-out, that is insurance. For the most part, we want to measure financial health regardless of product usage. That said, products are an important part of this conversation. It's important for providers to understand the needs of their target market, so to offer a product that is relevant, high quality, and will improve their users' financial health. Looking at these numbers, it might be tempting to conclude that income might be a proxy for financial health, that some of the folks in the vulnerable or coping segments, the not healthy, the 57% I spoke to earlier, it's simply an issue of lack of income. It's certainly true for some, but it's not the whole story. More than a third of those who are considered coping or vulnerable make more than $60,000 a year. 13% of those make more than $100,000 a year. Conversely, over a third of people considered healthy make less than $60,000 a year. So much like physical health, financial health is a topic in which behavior really matters. 2 behaviors in particular have a huge impact on your financial health, no matter how much money you make: planning ahead and saving. Well, constant, including income, we found that people who plan ahead for large, irregular expenses are 10 times more likely to be financially healthy than those who don't. People who have planned savings habit are 4 times more likely to be financially healthy than those who don't. So the purpose of this framing is really to highlight a few key pieces. One, that using health as a definition for consumer finances is more inclusive and has a much broader footprint than just underbanked or unbanked. That product usage, while is important and relevant, is not the whole story. It really is around behaviors and instilling those behaviors in consumers in a long-lasting and meaningful way, and then providing the appropriate and relevant products to help them on their financial health journey. While there are different implications, for behavior and product use, the bottom line is that financial health is stressful and impacts everyday lives. So where do most of us spend our days? At work. Over 40% of Americans struggle and juggle to pay bills on time. That results in an enormous and overwhelming amount of mental accounting, which requires a mastery of timing and arithmetic, thinking that this bill can wait 3 days until this dollar amount is received, which takes X number of days to clear, and so on. It's a constant balancing act. A full quarter of Americans have admitted to worrying most of the time about their finances. We've all been stressed out at one point or another and know the implications of that stress on our focus and our energy. In terms of money on hand, ready for retirement or an unexpected expense, the numbers are also striking. It's imperative that a consumer has both a suitable retirement and separate from emergency savings cushions. Having neither is incredibly stressful. And the reality for many Americans, this is the reality for many Americans that are employed. You can see where we're going with this. For the next few few slides, they want to simply walk through some of the staggering statistics of exactly what the impact of financial stress is on employers and employees. Really talk through how, like many of you on the phone and Clearpoint, also came to this conclusion of this particular distribution channel. At least 25% of employees, regardless of their position or salary, are financially stressed and costing businesses every year in the following ways. There's reduced productivity. Like I just mentioned, we've all been under stress at some point and understand the impact of that on our focus and our productivity. Spending about 20 hours per month distracted by financial issues is the reality for employees that are stressed on this subject. Can lead to workplace accidents. 60 to 80% of on-the-job accidents are stress-related. There's, of course, the obvious health and welfare issues. 75 to 90% of all doctor visits are stress-related, and these problems are increasingly the cost of the employer, burdened by the employer. 40% of employee turnover is due to stress, and some change of jobs will earn more short-term income, but can be financial burden for the employer as they think about rehiring and training. HR departments, which are notoriously kind of under-resourced and overworked, are really an issue and can be a distraction to these staff members in all companies. Other impacts of financial stress on employment, both from the employee and the employer angle. 97% of workers admit to addressing and managing personal finances during work hours. That's almost all of us, pretty much as close as you can get to all of us. So for those of us that are struggling financially or have employees that are struggling financially, that amount of management and the addressing of those issues will take up just that much more time. 80% of American workers report some degree of financial stress. Again, that is a lot of us. That's a lot of us. On the employer side, talking about costs, this is often hard to quantify and making that direct link between financial stress and employer costs, but several different organizations have undertaken some research and made some attempts and some estimates. The CFPB estimated that financial stress costs more than $5,000 annually per employee due to increased rates of absenteeism or other negative impacts of stress. To the turnover issue that we just spoke to, the expense of replacing employees lost due to those negative impacts averages 1.5 to 2.5 times an annual salary, with training costs alone adding up to $1,200 per employee. So I could rattle off 10 more statistics. For those of you who are on the phone, this PowerPoint will be made available as well as the sources that we've cited. So I encourage all of you to do your own research to get more of these quantifiable statistics on the impact of financial stress on employers. But from here, I'd like to turn it over to Leida and Emmanuel to talk us through how they arrived at not only their product, My Financial Blueprint, but their experience working with employees, employers, and how they landed in this space.
Great. Thank you so much, Tanya, and I really just thank you for helping us restart that presentation. Can you hear me okay? Just want to do a quick check.
You sound good.
All right. Thank you so much. Again, my name is Emmanuel Rivero. I'm the Director of Emerging Products and Services with Clearpoint Credit Counseling Solutions. And we've been serving the community since 1964. We're headquartered out of Atlanta, Georgia. And really, we came into the employer and employee financial wellness space via a pretty scary topic. It's mind-boggling to think about that maybe about a decade ago, in 2006, 2007, home prices started their downward spiral. And Clearpoint as an agency was launched into the front lines of that housing crisis. Now, during this period, we helped hundreds of thousands of consumers navigate those murky loss mitigation and foreclosure prevention waters. And we did a really, really great job of it. So Clearpoint primarily operated as an emergency room full of battle-wounded consumers who got into creative loans that they had no chance of repaying. So once a few years passed and the dust settled a little bit, we noticed that our client changed from primarily low to moderate income to more of a moderate income client overall. So because of the changing landscape, we asked ourselves a lot of questions to identify how we can serve consumers beyond crisis. How's our market changing? What opportunities do we have to serve? What are our biggest challenges going to be? And what do we do well? So we did a lot of self-analysis, and how are we willing to evolve to really step into the space? So in looking at our landscape, what we found, we came to some responses, right, to some logical conclusions as we did this self-analysis. So in looking at the space, we found that fewer households several years later were in crisis, but there's still a huge opportunity in helping low and moderate income consumers avoid crisis. So there's definitely an opportunity to take a proactive role there. So what could we as a nonprofit 501c3 organization do without violating any regulations set forth by the SEC or FINRA? We were thinking heavily about getting into the traditional financial advisory realm, but there were just regulations that limited us from doing so. So how innovative could we get and still play by the rules? Was something that we kept asking ourselves. Well, I mean, we've been doing debt management plans since 1964 and been helping people with budget and credit, and we're really great at it, but that's what we've been doing. That's a little bit too status quo for us. So we found our answer in providing high-quality financial crisis services, but we also decided we were going to become leaders in averting financial crisis. So at this point, Clearpoint is filling a glaring gap in the financial services marketplace, which lacks a high-quality financial advisory-style service for low to moderate income consumers. What we found in speaking to some of our clients is that many traditional advisors tend to shy away from working with clients who don't have a certain level of assets to invest. So how do we bring this financial knowledge to consumers who don't have much in their investment portfolio? We were able to answer that question via a program we started developing in 2013 called My Financial Blueprint. So the goal with My Financial Blueprint was to provide financial advisory services to low to moderate income households that are long-term relationship-based. We would provide access to what we call financial architects that could respond to a wide variety of needs and circumstances regardless of asset levels. So what this allows is for clients to envision what they want to accomplish for themselves and their families. We take them through a coaching process that is more question-oriented, and we allow the clients to come to their own conclusions after having some discussion with our architects. They receive professional support in accomplishing their goals and making sound financial decisions. So what we're aiming for with the program is for behavioral change so that we can meet clients where they are and combine the skills of coaching, advisory, and education to spur and sustain action with our clients. So we said, okay, great, we've got a cool logo, we've got a cute piggy on it, and we're going to launch this program. So we said, who's going to use the program, right? How are we going to take this to market? So initially, this was a business-to-consumer product. We were going to go consumer direct, and naturally, we looked at our existing book of business. We thought, so why don't we test this idea on our debt management plan clients who successfully paid off all their debt, right? They completed the debt management plan. They've got a couple of extra discretionary dollars. Maybe they want to meet other financial goals. Is it buying a house? Is it understanding retirement plans or just what benefits are available to them? A lesson learned early on was that approaching clients that had just finished their debt management plan with us was probably not the best idea. In speaking with them, they were just fatigued after 3 to 5 years of credit card and debt repayment, and they just needed a break from that whole financial counseling bit. They were a little bit over it. So what we noticed is that we still needed to fill a gap and needed to offer services to consumers, but the consumer, after many focus groups and a lot of further discussion, the consumer wasn't really willing to pay for that. So we faced our biggest challenge in the program's short lifespan. How do we still fill the gap we know exists and bring service to a consumer who is unwilling to pay? Well, luckily here recently, the stars have aligned in our favor with the growing buzz around financial wellness in the workplace. That's not surprising, though. You know, to Tanya's point, 70% of us are living paycheck to paycheck regardless of income. So it's a growing market in the financial services, and many times the programs are paid for by the employer and services are provided to the employee for free. We absolutely love that idea. So at this point, My Financial Blueprint has a new logo. We're more business-to-business minded, and what we're doing is we're approaching companies and just explaining some of the benefits and some of the pain points that Tanya alluded to earlier, just to see how we can help their workforce be more productive, reduce absenteeism, reduce their levels of stress, and have an overall more loyal, engaged workforce. So it's adapted to multiple partners. We're working with everything from utility companies. There are trucking companies that we work with, and we're also taking My Financial Blueprint and adapting it as a financial wellness package for some of our veterans. So what we found is that we're able to take the program and expand it across many different sectors. We focus on engaging with the partner and having a collaborative rollout plan, because what we found is that this is not and cannot be a one-size-fits-all solution. If a company happens to have remote employees all over the country, then we need to be prepared with webinars to enroll folks onto the program. If they have one plant and we need to go out there face-to-face, that's what we found is the best way to approach that type of employer. So that's something that we've learned as we've developed the program, is that really we're at the beck and call of the employer and what needs they have and what key performance indicators they want to impact. Really cool thing we also have developed is partner data sharing. So some of our partners approach us and they say, every single month I get at least 5 to 10 requests for 401k loans. How do I stop that? So at that point, we step in, we develop an action plan for that employer, and then we can gauge success by monitoring the number of requests that particular employer has received after we launch the My Financial Blueprint program. So we can get very creative to sort of move the needle in the direction that the employer would like to see it moved. So most recently, we've been involved in having some great discussions with everything from EAP providers, right? We're talking to a lot of employee assistance programs to see if we could bring the My Financial Blueprint service offering as a combination with the rest of their services. We are speaking with Opportune, who is also a member of the CFSI network, and we are developing a plan for their clients as well as for their employees. And recently, California Pizza Kitchen reached out to us because they really want to get involved in the financial wellness in the workplace space as it relates to their leadership team. So what we're finding is that a lot of companies, they buy into it, but it's almost like employers want to dip their toe in the waters. They want to test it out. And that's one of the bigger challenges we've had, right? How do we prove return on investment that having employees that are not financially stressed is going to be all around better for the employer as well as the employee? So everybody is sort of in test mode right now, but there's a lot of great movement in the space, and what we'd like to see at Clearpoint is an inherent change in the way companies view benefit packages for their employees. So financial capability benefits should complement standard retirement packages, because a lot of times employees really just don't know what's available, that their company matches some of their deposits into their 401k, and that type of information needs to be brought to the workplace. So during our journey into the employee financial wellness market, what we realized is that we've been firefighters during crisis, but we really need to be involved in helping consumers have their financial sprinklers and smoke detectors in place. That's how we avoid financial fires. Thank you guys for your time this afternoon.
Thank you so much, Emmanuel. I want to just double check that you can hear me.
I can.
Okay. Yeah, so thank you for that brief presentation. It was kind of a lot of evolutionary and strategic decisions compacted into a small amount of time with great insight on where the consumer is that you're really targeting. And it's always encouraging and exciting here at CFSI and just generally to be able to watch a provider really adapt to and take cues from where the market is and how to, really create the most impact in their targeted consumers' financial health. At this point in the presentation, we're going to do a little bit of moderated discussion. Again, I encourage folks to type in their questions. We have a few coming in that we're going to kind of filter through. But as moderator, I'm going to take a little bit of prerogative here and start with a few questions that I have for both Leida and Emmanuel. So my financial blueprint specifically, and kind of employer-based solutions generally, there's a unique engagement strategy that's involved to really get to the end user. There's a few steps. You talked about initially being B2C and moving from B to B to C, if you will. You have to sell this idea both to the employer and then sell and design the product for the end user. Can you talk a little bit about some of the insights you've learned about employer uptake, both the challenges and successes?
Absolutely. So that's a great question. I think that it's a two-pronged answer. One of the things that was really not surprising, but in hindsight, we didn't take into account the seasonality of financial wellness benefits in the workplace. It is very much tied to annual enrollment periods, right? So when we're looking at the fall, when we're looking at September, October, November, by the time that we speak to potential employers, if it is the beginning of the year, chances are they've already developed their budgets, so we are unable to deliver on our mission and getting that to the consumer because that's already been worked out in the fall. So one of the challenges we face is definitely the seasonality. And then the other I mentioned a little bit earlier, the tracking down the return on investment as it relates to individual business sectors is really a challenge, right? Until you can prove that it proved to the employer or prove to the company that it works, we're not going to be able to get our foot in the door, and we won't be able to bring this product to low to moderate income employers or even moderate income employers. So I want to say definitely seasonality and proving return on investment has been our biggest challenges.
You've had with employers, and if you've seen trends with the types of employers that are kind of a little bit more attuned to this as a benefit, or if it really is just a timing issue. But could you speak a little bit to some of the positive experiences you've had?
Absolutely. We work with several employers, and one of the employers that we recently started offering the service to initially began their financial wellness program with an online-only solution. So basically, it was a learning portal for their employees, and they would go on and receive just fantastic information. And that's great. But what they noticed is that when they surveyed their employees and when they were asking their workforce more questions, They really wanted just a human being to speak to. So where we came in terms of My Financial Blueprint is that we have a three-pronged approach to our service delivery. We have what we call our financial architect, which is an actual human being who builds a relationships with our clients. We have a personalized online learning portal, and then there's also an account aggregation tool that is both architect-facing as well as client-facing. So the success that we found is that we are a one-stop shop. We are not only an online education platform. We're not only an account aggregator. We combine all three prongs of the financial wellness sector, and we're able to deliver our services that way.
Emmanuel, I think that hits on a really important piece of the financial capability, financial health framework, in that the need for that one-on-one kind of personal assistance and coaching is one that is well known throughout this space, but is notoriously high touch. And there's a lot of different combinations of using technology to mitigate some of the needed resources there. And I think the architect model of different types of check-ins and real-time tracking is a great way to kind of address that challenge. And thinking more broadly about what other pieces consumers really latch onto through the evolution of My Financial Blueprint, can you talk to us a little bit about some of the lessons you've learned about consumer behavior generally, and using that three-pronged approach that My Financial Blueprint offers, how those work in tandem, which pieces really might spur behavior change when it comes to consumer financial health?
That's a fantastic question. And what I'll do is I'm going to ask Leida Speller, who is the manager of our Emerging Products and Services division, to field that question. She is very hands-on with our clients and just has great perspective on consumer behavior.
Yeah, hi, good afternoon. This is Leida. So planning to answer that question, which is a great question, I would say that some of the most important, I guess, lessons that we've learned about consumer behavior are, I guess, the first being that many of the people we've worked with who are very serious about reaching their financial goals really do desire and welcome accountability. They actually see value in just having someone who understands what it is they want to accomplish, who's aware of how it is that they need to kind of get there, and who's also able to give them an honest account of how their behavior is impacting, whether or not they're moving toward or away from their goals. So that's kind of one thing. Another thing that I think we've learned about consumer behavior is that people really want help. Like they really do appreciate the context of the coaching relationship. For example, one thing that people really value in this process is getting support in addressing credit issues. But it isn't quite enough to just say, okay, you need to pay off these collection items or these judgments or pay your bills on time. They would much rather have someone give them a blueprint that says, okay, so maybe we can do things like reduce, your spending in this area to put toward your excess debt. I mean, they really want help in understanding just how the impact of their decisions maybe in one area impacts another.
Yeah, that makes a lot of sense. I'm going to consolidate a couple of questions that we're getting here and just some experience CFPB has had with our network members that are dabbling in this space or even kind of deeply in this space. There's two kind of looming challenges that providers in this space are facing, and I think that has to do with the cost structure, whether it's subscription-based fee model per person, per seat, whatever that might be. So Clearpoint, if you could talk a little bit about how you've, especially as a 501c3, which kind of uniquely positions y'all in this space, but talk a little bit to that, and then this other challenge around a little weariness or a leeriness, if you will, on the users and the end users, and on mixing their employer and their finances, wanting to maybe hold those cards closer to their chest or not reveal or expose their financial reality to their employers, maybe not fully trusting that there is, kind of an iron wall that data won't be shared. But on the flip of that, employers being interested in tracking outcomes and having some data. So if you think about, I know those are two kind of large separate questions, but we're getting a lot of kind of energy on the question feed around those two issues. So I'd like you to speak to both of those in your experience.
Yeah, absolutely. So in terms of pricing structure, as a not-for-profit, we've got partnerships with lots of different entities, including the Fannies, the Freddies of the world, several lenders, and we usually, in our agreements with them, we set up a fee-for-service model, right? So if we happen to conduct a counseling session, we would say, okay, let me send you a bill for X number of dollars, right? So it would be very much a fee-for-service. When we approached employers with a fee-for-service model, we noticed that it became difficult for us to administer how many employees enrolled, month in and month out, but it also became difficult for the employer to forecast approximately, how many employees are going to enroll, right? So there's this crystal ball of utilization, and when we approached employers with a fee-for-service, it wasn't very well received. So we do have that still as an option for our smaller employers that still want to bring My Financial Blueprint to the workplace, but what we found is we need to give employers multiple pricing options. So the way that we approached it is we took a look at pricing models that human resource directors and human resource leaders are used to seeing. So we looked at EAP pricing, and usually employee assistance program pricing is per month per employee. So for example, if a firm has 1,000 employees and it's $2 per month per employee, you do the math on that and you can forecast out how much you will have to pay every single month or for the year for that particular benefit. So we altered our pricing model to be very similar to employee assistance programs. It's on a tier, right? So we go from like 0 to 500, it's X number of dollars per month, 500 to 1,000, and so on. But it doesn't pass $4 per month per employee, right? What we're trying to do is deliver on our mission and make sure that we bring a price-effective solution so that we can continue to deliver on our mission of consumer health through financial education.
Really quick note for those on the phone that might be familiar with the CFPB's report on employer-based financial wellness, the stat that they had been using was about $12 per employee per month, so that $4 mark that Clearpoint is using is well below that number. But Emmanuel, yeah, now if you could speak to the data issue both from the end user's angle and the employer's angle.
Yeah, that's the biggest end user, concern that we face, right? So when we're speaking to employers and we're sitting in a room in front of them and we're getting them really excited just about getting their finances in order, they're jumping up and down, they're really, really excited, and then they sit back down and think, wait a second, these guys are in cahoots with my employer, right? I don't feel comfortable with sharing a lot of information with these guys. So the way we approach that is during our enrollment sessions, we are very clear with the end user, with the employees, that any data that is shared with their employer is aggregate data. So it's not going to be that Susie Smith has a 617 FICO and her unsecured debt is $5,000. No, we're going to say, okay, your workforce as a whole, in terms of data, you're looking at folks that have credit scores right around this range and unsecured debt here, or these are some of the topics that they want to learn about. And we found that some employers, they don't even want that data. They could care less. What they want to see is they want to see how many people are using it, and via survey, are they less stressed at work? Another important KPI, as I was mentioning earlier, or key performance indicators for employers, are absenteeism. They're looking at 401k loan requests. They're looking at presenteeism, right? They're dealing with distracted employees who are present at work, but their mind is elsewhere. So that's the point that we bring to the employee, right, to the end user. No personal identifiable information is ever going to be shared with your company, and if ever any data is shared, it is primarily in aggregate form. So we're not in the business of discussing that information.
Yep, that's interesting. As we think about the employer tracking financial health and just, you know, providers generally tracking and measuring financial health, there's obviously a quantifiable piece to that, but the ROI, if you really want to tie the investment in this particular product to kind of a bottom line business number, there's at least at this point a little bit of a leap of faith that the employer needs to take, because creating those direct links, there's a lot of challenge from kind of a scientific or methodological perspective. So in the meantime, as we think about tracking outcomes and measuring financial health, I mentioned at the beginning of the webinar that CFSI has been spending a lot of time thinking about how to do just that and what metrics can be used by providers that is quantifiable but also is suggestive of behavior. We know that the CFPB has a financial well-being scale, and there's a question around what portion of employers or partners are you seeing that might already be using that assessment for, you know, their baseline to track improvement and track impact of this particular product or other products, or do you seek out employers that already have that kind of mindset or ability or desire to track financial health?
Yeah, great question. Usually the employers that we have encountered, the only financial wellness or financial capability benefit that they normally have on board is whatever is packaged through their 401k or other retirement plan provider. So when we come in, they don't have those metrics in place and have not been tracking anything as it relates to those outcomes tied back to financial wellness. So that's not to say that other companies aren't already tracking those outcomes, that they're not already looking at those certain key performance indicators to look at ROI. But the employers that we have come in contact with and that we've spoken to My Financial Blueprint, we brought that to them, you know, they haven't had anything in place. So we really needed to be guides and educators in that space to say, look, these are some of the pain points you're going to want to try to track.
Yep, that makes sense. This next question, I think, is actually a nice natural progression from that. And you know, you've talked about My Financial Blueprint and its unique value and its three-pronged approach. And we have a couple of questions from non-employers on the call around if nonprofit organizations can use this service to offer financial counseling to their clients.
They can, right? So they can certainly do so, and that would be a completely separate, you know, discussion in terms of pricing, in terms of does that nonprofit have grant funding available for us to do the work. Like we mentioned earlier, we've been able to adapt My Financial Blueprint across a lot of different sectors, and even outside of the employer world when we're looking at some of the work we're doing in the veteran space. So there's definitely an opportunity for us to bring this to clients in another nonprofit. It would just be a little bit of a different discussion in terms of the funding. Absolutely.
I think that's a really unique advantage that you as a 501c3 and with decades-long reputation in this space and really a consumer-centric approach to the work that you do kind of catch the eye of a variety of different types of organizations and providers, and this product is no different. I'm going to ask one last kind of general question that we like to kind of probe all of our network members with and have folks really be marinating and ruminating on this question generally. And it's not specific to my financial blueprint, but I certainly assume that there's an element of your response that will include the product. But where do you see the greatest potential to improve consumer financial health lying?
That's a great question. You know, I would say it's in repetition. It's in repetition of the message that financial education and financial literacy, you know, is lacking, right? So that message, I think, needs to be reported over and over again. We've got great stats. We've got data showing the issue we have here in the U.S. And I really think that this would allow organizations who offer these types of solutions, whether it be us on the nonprofit side as well as you, CFSI, being involved in the space and just being advocates for consumers, I think that might be the greatest potential, right? It's almost like a PR ploy. Let's get the message out there. Let's spur interest. Let's get networks like this together. You know, let's start looking at lobbying and what can we do to really impact the space early on? How proactive can we get? How do we get into the school system and bring financial education? So I want to say it's repetition in the message that there's a huge need for financial literacy education. And in the end, that'll trickle down to consumer and improving consumer financial health.
Great. I appreciate that. Okay, so we started to slow down on the question feed, and I've gotten to everything that we had wanted to discuss. I just want to thank you again, Emmanuel and Leida, for joining us this afternoon, for the myriad folks on the line that had patience to stick through those first 10 minutes. I apologize again for that. I'm not sure what happened there, but I appreciate the folks that are still on the line, and I see that number hasn't diminished over that hour. So thank you for kind of bearing with us. And I do just want to end on, again, speaking to not only the relationship that CFSI has had with Clearpoint over the years and the kind of various consulting engagements that we've worked with them on and supported them getting to this place in their journey and this place in their product offerings. CFSI has a pretty robust consulting service and department. So one of the pieces that we did with Clearpoint was really just getting underneath product design, using our kind of robust and deep consumer insights, using our compass principles as a way to evaluate quality, deep private sector experience and network, help think through product design, distribution channel, et cetera. So that's one of several services and products that our consulting team offers. If you want to learn more about it and you are a network member, please reach out to your relationship manager or myself. Contact information is here on the deck. We'd love to help you all think through product and service design to improve consumer financial health. Again, this deck and all of the audio will be made available shortly after the webinar. And I want to, again, thank you all for your time this afternoon, your patience earlier on the call, to Leida and Emmanuel for your time and commitment to consumer financial health, and hope that you all have a nice afternoon.